Left of the box. Price tag for rescuing Alberta's privatized lab services become clearer. Moving back to a public system will cost $97 million, budget numbers show. Yes, the cost of privatizing things just seems to always go up and up and up. Alberta's failed attempt to privatize lab services was an expensive and unnecessary lesson for the government, critics say, as the price tag becomes increasingly clear. So money wasted trying to privatize something that could have been used to actually help their public healthcare system. Wonderful. And the public healthcare system in Alberta, I think it's worse than Ontario for the moment. Ontario is doing everything it can to be the worst. It's working on it. But I think Alberta is still in the worst situation right now. So much of our taxpayer money is not being used appropriately. Again, this is part of the reason why I'm like, the entire government just needs an overhaul. Because they're not spending the money, the tax money, the way that they're supposed to, the way that they promise. And it ends up just hurting people in the long run. Numbers in Alberta recent budget shows the cost to buy out the Dillon Life operations was $31.5 million, and the government says it assumed liabilities are pegged to another $65.5 million. So something that people need to be cautious about and why we need to fight even harder right now is once something becomes privatized, to reverse it becomes really difficult and expensive because then they can sue for lost profits and all this sort of bullshit stuff. So it's important to make sure it doesn't get privatized in the first place. Looking at you, Ontario. Doug Ford. Wait times ballooned last year after Alberta Health Services, AHS, expanded its contract with Dillon Life? I don't know. To include community lab services in Calgary and many other parts of the province that weren't already handled by the company. The province ultimately reversed course on the privatization plan. A deal was struck to transfer all the private provider staff and operation to the province to Alberta Precision Laboratories, which is owned by AHS. It's the public picking up the pieces of failed privatization projects, said Chris Galloway, Executive Director of Friends of Medicare. It didn't work. It made the whole lab system work less efficiently, made the experience of patients worse. It made the experience of workers worse. This was a nightmare, says Dr. John Meddings, a professor and past dean of medicine in the University of Calgary. He was personally affected by the backlogs after lab services transitioned to Dillon Life. His wife, who has a malignancy, required careful follow-up and had to travel outside of Calgary to get timely appointments. She was utterly unable to get lab tests done, so we left town to get things done. Not everyone would have the ability to do that. Like, that's the thing. That's when class and privilege start taking place, where only if you have the resources, only if you have the means, can you actually get the healthcare you need in a timely manner. I'm in a situation now where I'm needing a lot of health care. My body is just falling apart for reasons. The wait times for some of this appointments with specialists and stuff, it's scary. Because you go in and they say, oh, we find something, and it could be this, and this, and, you know, of course, some of it is worst case scenario, and we're telling you that. It doesn't mean that it's even remotely chances of that, but this could be the worst case scenario. And then you're sent off home, and it's like, well, your doctor should get to you in a week about doing tests to follow up that you should then get in another week or two. And then after that, you can maybe book an appointment with a specialist. But in the meantime, if you start suffering this, and this symptoms, get yourself to emerge because you could die. So, you know, you kind of want the test results done faster so you don't have to worry about it. And so when you have things like this, like if you don't have a car, if you don't have transportation, some tests are now out of pocket, aren't covered by an ODSP or your provincial health plans anymore. And it's becoming scarier, and we'll get to how dire it is becoming in this country. According to Meddings, the province's struggling healthcare system could have put the $97 million to better use. It's an unnecessary expense. How many nurses have we forgone for that? Lauren Hardcastle, who teaches health law and policy at the University of Calgary, called it an expensive lesson for the government. It's a big number and one that could have been avoided with some foresight. A lot of people were sounding the alarms on this transition, she said, noting labs are not an ancillary service such as laundry or food service. I'll just skip down to the bottom here. The Office of the Auditor General says examination of the contract with Dylan Life continues, but it has experienced delays getting interviews and information from AHS. It is unclear when the work will be done. Meanwhile, the Alberta government said it's continued to work to improve lab service in the province. This change has been an important step to improve and grow lab services and make sure Albertans have reliable and speedy lab testing of their own communities, said Andrea Smith, press secretary, blah, blah, blah. According to the ministry, the number of weekly appointments in Calgary increased 40% between May and December of last year. Wouldn't surprise me if COVID had something to do with that. A lot of people suffering long COVID, trying to figure out what's all of a sudden they're fatigued or things seem off in their body and blah, blah, blah. And they want to go for this test and that test. And Canada isn't doing what it needs to deal with the increase of people suffering from long COVID.